to everyone out there in the universe. This is Alex Evans, and I am joined by two of some great individuals. I've got Candace Caesar, I've got Daffodil Baez, and in the background, I've got Scott Patterson, and we are here to present the inaugural podcast for Apex Health. We're concentrating on healthcare in general, looking at or trying to break down what it is about healthcare that affects the community, affects individuals, but on the grand scheme also affects everyone. We're going to be talking to CEOs, we're going to be talking to insurance companies, we're going to be talking to several people across the spectrum, trying to break it down and see what's really the issues that you want to know about. Today, in our inaugural podcast, we have a great individual that's been a friend of mine forever. She's the CEO of a local hospital. Her name is Daffodil Baez, and she is the CEO of Fort Washington Hospital. And I'm going to let her go into her introduction a little more and tell her a little bit about herself. But before that, we also have as my co-host, one of my co-hosts, Candace Caesar, who is a professional mental health provider, and she's going to be also letting us know some things that attack us from the mental health side of things. But Daffodil, take it away. Tell us a little bit about yourself.
Greetings, everyone. It's such a pleasure to be here. Thank you for the invitation, Alex, to join this conversation. So proud to see what you're doing. Candace, it's so lovely to see you every time. Thank you for joining us. And Scott, such a pleasure in meeting you. As Dr. Evans mentioned, my name is Daffodil Baez. Currently, I serve as the president of the Fort Washington Medical Center in Southern Maryland. I'm located in gorgeous Prince George's County. But like other folks on this call, I'm founder of a couple other ventures, including Fortress Therapeutics, which is a wellness herbal remedies organization, as well as Supera Health, where I provide early stage consulting for companies, as well as some general consulting for Latino sensitivity in particular for organizations. I've been in healthcare my entire life. I'm one of those just grown up healthcare nerds. For high school, I'm originally from Texas. I wanted to be like you when I grew up, Alex. I wanted to be a surgeon, but the Lord had other plans. And so I ended up securing a master's in public health as well as an MBA, and have been started off on the payer side, actually, working for one of the major insurance companies here in the US, and then transitioned to practice operations, growing from primary care to behavioral health, multi-specialty practice, academic medicine, and am now responsible, as I mentioned, for a portfolio that includes hospital, ambulatory surgery center, and outpatient care.
Wow, that's an amazing choice.
Absolutely.
I've seen a lot so far. Yeah, it's been an interesting ride.
Okay. So one thing we wanted to do differently in this podcast, Daffodil, and thank you so much for telling us about your history, because we get a really clear view of who you are. But we wanted to talk about people, not just titles. I want to ask you this question. When was the last time that you simply sat with a patient, not as a CEO, but just as another human being?
I appreciate that question, Candace, for a couple of reasons. The first is that I tell my team all the time, we classify people as patients, right? They get this label as patient when they walk in through our doors, but frankly, they're humans, right? And in particular at a hospital like ours, which is a smaller community hospital, you're very frequently running into the teachers, your fellow church members, your neighbors, the small business owners, right? These are human beings, and they just happen to fall into the category of patient when they're under your care. To answer your question directly, I round frequently on the floor. And so I had a lovely conversation actually with one of our patients 2 days ago. But this is not unusual, right? It's part of how I like to keep the pulse of how we're doing as an organization. Sure, I look at the data, I read the surveys, I read every single comment that comes back from our patient surveys on a weekly basis. But I also just like to sit right with the folks in the community, the folks who, because when they're coming to you, a lot of times that's the toughest day, right? Or one
Yes.
of the toughest days of their week, their month, their life. And so connecting with them on and displaying that compassion really helps to clarify the fact then that they are in good hands, safe hands, hands that they can trust, with the team that they can trust to do what's in their best interest and what's in their family's best interest.
Mm-hmm. Yeah.
Wow. So, Daffodil, thank you so much for that great answer, and that's so point because it gets to the meat of the situation where, at the end of the day, patients slash people are what make up healthcare, right?
Mm-hmm.
If you could think in your mind, what in to you makes the best CEO? Like what about a CEO makes you good?
Well, that's that's a multi-layered question for sure, Dr.
Okay.
Evans. I might slip and call you Alex every once in a while, but
Please,
so
this is a laid back situation.
thank you. You know, leadership in healthcare today requires quite a bit from the folks who are sitting in those seats. And one of the conversations that I have with my team on a regular basis as well is that, we are all leaders. We all have the capacity to be leaders. You don't necessarily have to have it as a title, right? You can
Mm-hmm.
self lead. And what leadership requires today is a few highlights, in my opinion. The first is operational discipline. So
Mm,
within that concept is included the fact that you are tracking your performance, that you understand what you are attempting to achieve, and that you have the discipline to stick to the objectives that you have outlined for yourself and your team without going off on side quests. Okay, because side quests are often expensive and can distract your focus. And in a world where your resources are limited, and resources in healthcare, particularly for the folks who are on the front line or closest to the care delivery, are limited. They have limited time, they have limited energy, and there's a significant amount of demand. It's important for you to stay focused. So operational discipline, I would say, is definitely one of the main things. Second, I would say transparency. I have very open conversations with my team. It's part of my personal brand. We need to know what we're up against and the problem that we're trying to solve. We need everyone rowing in the same direction. And
mm.
so I believe that you actually get more as a team when you have clear and candid conversations amongst yourselves so that you can stay focused on the target, right? And then
Wow.
finally, I would say that there's definitely a degree of flexibility, curiosity, creativity that's needed because we're facing challenges and situations that we have not faced before. And so frequently there is no playbook. And so you have to craft the solution. You have to architect the path,
Is it
right? It's not already
doing this?
pre-identified for you. And so having that sense of I call it cognitive flexibility is critically important to being able to react well in today's environment.
You said something, that, piqued my interest a little bit there when you talked about, the amount of flexibility that you needed in healthcare. I'm thinking about COVID and the fact that, a lot of companies that were able to adapt, those are the companies that came through the pandemic, but the companies that weren't able
Mhm.
to adapt, they, got run through. So adaptability is really, really important. And like you said before, like not only knowing where you want to go, but understanding the analytics in this society, is also very important. Yeah. But Alex, are you
Mhm.
back? Yeah. That was just a comment.
Thank you.
Talk about being able to direct a team, one focus, being open and expressing itself in those manners. Tell me a little bit more about when you have all these dynamic changes going on in the government and as far as health requirements, etc. How do you deliver those information to your team, but then keep the morale or keep their interest, keep them basically motivated to keep going?
That's a great question. So, remaining motivated in the face of a highly complex, highly regulated industry can be a little bit of a balancing act sometimes, because again, it never feels like you have enough. It never feels like you have enough money. It never feels like you have enough staff. It never feels like you have enough time, right, to do everything that you want to do. But what we need to realize, and what I wish more people in the general public took a moment to reflect on sometimes, is that you don't go into healthcare as a selfish person. Right. The people who are in healthcare writ large, right? 99.99999 are folks who are motivated by an internal moral imperative to leave the world in a better place than where they found it. And
That's a
so
great answer.
reminding ourselves of why we do what we do, why we chose this path. So many of us could be in other industries getting paid better, frankly, but we wanted to give back. We wanted to give back to our community. We wanted to make an impact in someone's life. And so reminding ourselves that when people come to us on their toughest days with their most difficult challenges, where they truly depend on our expertise to make a difference in their lives, right? Those are the things that matter. And as long as you keep that as a focus. Sometimes you'll hear the phrase, patient focused, and that's part of what it can be, right? If you remember that you are there to make a difference at the human who's at the center of whatever that encounter might be, and that if you deliver your expertise, you have done what you came here to do, what you were put here to do, then it's been a good day. And so that's part of what I remind my team about, is that someone's day today is better because you were in it.
Wow, and that's a great way to look at it. Now, you mentioned money, and it's so interesting because unfortunately, you see these ads and so forth that makes it sound like hospitals are overflowing with money and the people who work there are just rich and so forth. Talk to me a little bit about the financial strains and the narrow margins that you have to try to maintain to stay afloat. What are some of the obstacles and the challenges in running a hospital?
So, okay, let's first of all level set the financial picture for most of healthcare compared to other industries. Okay. And it sounds like the question is mostly directed towards the healthcare delivery component of the industry. In other industries, right, in publicly traded companies, even in privately owned companies, you're usually targeting a profit margin of something like 10 to 15, right? That's kind of like a standard, fairly healthy profit margin. In high margin industries, you might be lucky to get something up to, 25 or even 30% of a profit margin. In healthcare, you are blessed. You are lucky if you are consistently running a profit margin of 2 to 3%.
Wow.
Lucky.
That's
Okay. And many hospitals are running operationally either at very close to break even or below break even, which means that they have to be subsidized by other components of their system. So hospitals as a whole in general are not massive profit driving engines. And the reason why they're not massive profit driving engines is because the overhead is so high.
Yes.
The equipment, the staff, the facilities costs. I cannot tell you the utilities costs for our hospitals, like literally the electric and water bills have been going through the roof. The same thing that you see happening at home, where people have this public outcry about their utility bills. Same thing is happening at the hospital, except it's a $30,000 water bill, right? It's a
wow.
$50,000 electric bill, right? So and we're a small hospital, right? We're not even a 150, 200, 300 bed academic facility like you're at, Dr. Evans. So there are multiple factors, right? There is not enough supply of the talent that you need, and that creates additional competition for that supply. And so there are many factors that make running a hospital a quite expensive endeavor, which is why it's actually so important that communities become informed about the healthcare infrastructure that is present in their community and highlight how to protect it. Because once you lose it, the cost of attempting to reinstate or reactivate that infrastructure is very high.
Wow.
Wow,
Wow.
wow. Yeah,
And
that's
and when,
excellent.
yeah, yeah. And when resources become tighter, we know that the patients feel that. In what ways do you think patients feel those resources becoming tighter?
The first, without question, is access. So you will have noticed that there's, many articles, research, etc., around the fact that private practices, for example, can no longer afford many times to remain private. They have to join larger systems in order for their operations to be subsidized. Hospitals, many rural hospitals and many smaller community hospitals are closing down. And it's because of some of these cost pressures. And so what that means as a community member, right, is that you are losing access to the points of entry into care. You no longer have that doctor's office that's right down the street available to you. You no longer have that hospital that's within a 10 or 15-minute drive, right? You have to drive 30 minutes, an hour, right, to get to a healthcare facility. The downstream effect of that is that, number one, people do not engage in primary care and preventive care as frequently as they should many times because of that lack of access. And number two, they delay their care, right? So they're like, oh, it's just a little pain. I'll just take, a pain reliever, right? And I don't really pay attention to it. Or, I don't know if that's really a lump. I'm probably fine. I don't really need to be screened or checked or scanned. I can go another year. And when you do then present yourself to a healthcare professional, unfortunately, the situation has reached a higher level of acuity and it
Right.
becomes both more expensive and more complicated to arrive at a successful outcome.
Saying that just hits right at home for me because unfortunately, I see these individuals when they come in, they'll have abdominal pain or they'll have, like you mentioned, something that they just let go. Oh, I won't get the screening. I will. And when I come, they see me. They've got advanced colon cancer. I've got to take out the entire colon. They've got lumps on their breasts that are now, large lesion breast cancers that should, or just even if it's bowel obstruction, it's now they're an extremist. They're about to die when I'm taking the OR versus just doing something, fixing the hernia electively, coming in and, they go to their primary care doctor, oh yeah, that's something that Dr. Evans can do. And you go down to the street and see me. So it's literally a big shift. And I know that, that individuals are now using the emergency room as their primary care instead of going to the primary care doctor because again they don't have the access to care and also they don't have the insurance. Speaking of
Hmm.
that, what do you think about this? Some of the changes when it comes to insurance. I was reading an article that says that now it'll be about there another 13 million people are going to be without care once
Hmm.
they make the changes in access to care with Medicaid. What any thoughts on that? How is that going to affect you as a hospital when you're coming in? You're seeing all these people now, same people that they don't have health insurance.
Hmm.
Yes, the some of the policy changes are quite challenging, particularly for healthcare delivery providers, the care delivery portion of the industry,
Hmm.
because what it requires in hospitals specifically, if someone presents to your ED, right, to your emergency department, you cannot turn them away. It is
Hmm.
first of all illegal to turn them away, and second, I mean, we took an oath, right? So for us, it's
Right.
also a moral imperative that we are going to
Mm-hmm.
see you if you arrive at our location or any other hospital location. However, if you have then outlaid the resources, right?
Mm-hmm.
So we've utilized supplies, we might have delivered care, we've utilized staff time,
Mm.
physician time, and we don't get reimbursed for that care. Everyone
Hmm.
understands that if you give a service as a business, but you're not getting paid for that service,
Mm.
that becomes unsustainable,
Yes.
Right.
right? And so what happens is that it then places additional stress on those care delivery providers within their systems and within their communities. And it makes it very, very difficult to continue. How does that then impact a care delivery organization? Okay, well, you might have wanted to buy new equipment. You can no longer afford to do so. You might have wanted to expand a service line. You no longer have the capital to do that. You might have wanted to open up a new site of care. Your margin got eaten up, and so you're going to have to stay where you are, right?
Wow.
And so it's those kinds of very practical solutions, right? You might have wanted to hire more staff, right?
Right, right.
But if you're not getting reimbursed for a service that you're providing, right? That's a business model, it's a financial model that doesn't work.
Mhm.
Yeah,
So,
and it's circular. Yeah.
and it's circular. So my message, to the community is a couple of things. Number one is become informed. Become
Mm,
informed about the healthcare infrastructure in your community. Look at ratings, look at quality scores, and actively make decisions about where you choose to get your care based on those scores. Because we need to support the institutions that deliver high quality care. Second, take care of yourself as much as possible.
mm,
Please, it is so much more effective, so much more effective to be preventive and proactive in the care that you give yourself and your family, right? Than waiting for
Mhm.
an issue to come up. It is
mm.
definitely because let me tell you, someone might say, oh my God, I cannot believe that a primary care cash pay visit, let's say that I don't have insurance at all, right? I choose to pay cash for my annual doctor's visit. I cannot believe that it's $150 or $200 or $300.
Mm.
I guarantee you those 150 or 200 or 300 are definitely cheaper than the multi-thousand-dollar
It's a
bill
dollar
that you might
bill.
get if you show up to the ED, okay,
Exactly.
with a much more serious issue, right? That could have been caught much, much easier and much, much sooner.
You
So
are preaching.
become informed, right? Advocate for the companies that are doing the providers that are doing well by your community in your area, and be proactive in your own advocate in your care.
Absolutely.
Wow.
Thank you, Daffodil, for
Yeah.
sharing that and for laying out the imperative, how important it is for people to take care of themselves and to take ownership of their healthcare, also in paying attention to what's going on within their community health. Because when we don't have access, we're literally sort of cutting off our ability to have preventative care. So
Mhm.
I want to bring it to the staff, the doctors, the nurses that work for your company. How are you doing on recruitment? How are we doing on retention of these employees? How are we protecting against burnout, right? With everything that is going on.
Yeah, that's a great question, Candace.
Hmm.
We put quite a bit of effort of intentionality around attempting to retain our team members. We understand that people, without a doubt, are our most valuable asset,
Hmm.
and so we do you know things like internal recognitions, right?
Hmm.
Even small little celebrations, right? Highlighting the small wins, right, and the small moments of those unsung heroes, right,
Mm.
that do the work every day. We have official programs, right, for physician well-being, for staff well-being, where we talk about the fact that yes, this stress is here, right? And how do we decompress that? What are your, and everyone's a little bit different, right? So for me, that might look like, going for a hike. For someone else, that might look like, decompressing with tea and some reading time, right?
Tea
For
and
others, it
reading.
might be, something else, right? Pick a hobby. But acknowledging and identifying what works for you as an individual to pour back into yourself so that you
Hmm.
then have something left over to pour into others. There's, you know, we have we have a demographic shift that's happening in this country. It's actually a worldwide demographic shift. Some folks have named it the silver tsunami, right? Some of us already experience this, right, as having to caretake for our parents or grandparents, right? But a lot of our population is now aging, right?
Yeah.
And they're falling into a season of their lives where they require more support from those. So by definition, where our population demographics stand, the demand for services is outstripping supply, which is why we have to be creative in how we continue to craft how we do our work. It's why, the growth in technology is so important, and finding better ways and more efficient ways of being able to reach people where they are is so important, because the numbers, right, are just, if you have 5 over here and 2 over here, right, like there's always going to be a gap. And so recognizing that gap exists is part of the dialogue. And then, having conversations as a team about how do we better serve our particular community with its particular needs is an ongoing conversation that has to take place. I classify technology as a tool. So it is not in and of itself, by itself, morally good or bad. It's how we choose to use it. And so, we've been hearing about how technology was going to make our life easier in healthcare for as long as I've been in,
Yes.
in health, right? Like for
Exactly.
decades and decades. And yet it just seems to get more complicated.
Yeah.
On the other hand, I am actually a technophile, right? I believe that technology truly can make our lives better and should be incorporated into the work that we do. Specifically, I believe that technology should be utilized to amplify the expertise and the effort of the expert human that is utilizing that tool.
I
I
love
like how
that.
you said expert human. Yes, because we're not, shifting our responsibility from the patient to the computer or to AI. We're
We're
saying,
definitely
what,
not.
ultimately we are the experts. I love that. Continue.
There's no question. And the thing, by the way, Candace, at which we are the most expert is actually at being human, which is
Absolutely.
something that technology will never be able to replicate, right?
Thank you.
So, yes, things like ambient documentation are fantastic. It's still glitchy, they're still in pilot phases, they're still being refined, but I do think that something like that is amazing. Things like, utilizing AI to help result, whether it's images or pathology or whatever, right? Where you can train these large models to detect, infinitesimally small changes in images and slides and whatnot, makes it easier to diagnose, makes it faster to diagnose. And again, if you're talking about having a smaller number of people who are doing the work for a larger amount of demand, you need a tool that's going to amplify their efforts. And then you use that expert human, right, to look at the outliers or to look at the things that are uncommon, right, and ensure that what the machine has done is accurate and the best thing for the patient. So yes, I do believe that technology can be quite helpful. On the other hand, we need to remember that, again, technology is the subordinate, it is the tool, and therefore it should be designed for the human's benefit, right? So just because I can code something, right, does not mean that I should, if it does not make the human's life easier. If it does not mean that the likelihood of a positive outcome for the human that is under care, the patient that is under care, is more likely to be a positive one.
Thank you
Certainly not
so
if
much
it's
for
going to
saying
cause.
that. Thank you so much for saying that, Daffodil. We have to be so careful that we don't allow AI or the computer to become the patient, you know what I mean? Or the endpoint. We have to keep patient care centered on the patient. I just love that you say that because as a nurse, it was just so much. It's like we were babysitting the computer, right? And you would go in and you'd see them, you go in and you see the patient and they're falling off the bed. They need to use the bedpan. And it's like, okay, but this other nurse, oh my gosh, her documentation is perfect. So I just love that you just hit home on that point. So thank you so much for saying that in the most, just eloquent of ways. Thank you. Yeah.
I'll give you
I
I'll
want
give
to.
you a quick anecdote, Candace. There's some research that's going on right now around sepsis. Right, so sepsis is one of the main dangers, right, that a patient who has been hospitalized can undergo. And sepsis, as everyone here knows, is an infection that reaches the bloodstream, right? So it becomes
Right.
a systemic infection for the patient, can be very risky. Things can go downhill very quickly. Okay, so, they've been looking at, well, how can the tech tell us whether or not a patient is more likely to develop sepsis, or like what stage of sepsis they're in, et cetera. And what was interesting is that they were able to solve, for like 70 or 80% of this, right? But there was still this category of patients where like the tech hadn't been able to identify why they had fallen into sepsis, or whether they were likely to fall into sepsis. And do you know that when they were evaluating those cases, they found that when the nurse walked into the room, or when the physician walked into the room, they could visually detect better than the automated dashboard, right, about whether that patient was falling into sepsis. They could smell, right? Because you know how it is, there's a tactility sometimes to the care that you're delivering, right? That
Yes.
as a human you have more sensitivity to, that is not going to show up in the data sometimes. So the
Yes.
nurses be like, I can
Something's
smell that there's
wrong.
something off with patient, right? Like we need to intervene right now, and the dashboard hadn't yet flagged an alert to that patient. So
Wow.
I am not concerned about humans losing their job in healthcare, right? There's way too much of what we do that cannot be replicated by a machine. And I will just end with, a machine is never going to hold your hand, okay, the way another human will, and give you, that overflow of compassion and support.
Yeah.
That's an excellent point. I want to wrap this up.
Thank
I
you.
know that there's such a busy life that you have as a CEO, so I don't want to pull all your time. But there's a couple more things I wanted to just put on. Number one, if you could look over your career, and there was like, has there ever been a time when you said, "Hey, this just wasn't worth it"? Like, was there ever one time when you stopped and said, "No, I
I
don't
want
know
to
why I
quit.
went down this path"?
Have it.
Me out there like that, Alex.
I'm just saying, not necessarily now. I'm just saying over the, from Texas, Arizona.
Sure.
Course.
Oh man, there have been some very difficult days. There's no question about that. We have to deal with all kinds of stuff. I mean, y'all know how it is, right? You get thrown into natural disasters, weather-related events, right? A pandemic, okay, where it's like,
Tell me about it.
I could have chosen an easier path,
Yes.
right?
I could have
There's
stayed home for a
definitely
year.
some days where you're like,
Yeah.
I didn't have to work this hard, Lord.
Mm.
But And so, sure, there's definitely days where I wonder if, if the path could have been easier.
Mm.
But I don't know that just because the path would have been easier doesn't mean
Mm.
that the path
Worth
would have
it.
been better.
Yeah.
Bingo.
It wouldn't necessarily
Wow.
have been a better journey, right?
Yes.
Yeah.
I like to go hiking a lot, right? And so when you're out in the outdoors, right, you don't get to the awe-inspiring vistas, the scenery that just makes your jaw drop, the one that connects you to the transcendent by staying on the flat path.
Yes.
You
Wow.
have to put some
Speak. Now you,
into escalating some altitude, into carrying weight with you, right? Into preparing and packing for a journey in order to get to that summit. So, yeah, some days you're like, man, all right, this is what we're doing with our lives. We all had choices, and I
Yeah.
guess this is the one that I picked.
mm-hmm.
But I do not regret
Yeah.
having dedicated my life to the service of others
Yeah.
for 1 minute.
Thank you.
Wow.
Alex, I think that what we're going to use moving forward is that we're hiking again. Anytime it gets tough, I'm going to use your example and I'm going to say, you know what? We're hiking.
Yes.
Yep.
We're doing
Throw
it.
your pack on and let's go.
Let's
Yes, we're
go.
going to the summit. We're going to the summit.
We want to wrap up by
Yeah.
asking the
Love the
same.
analogy.
We want to wrap up by asking the same question to all of our interviewers. And at the end of the day, we're trying to come up with one that really hits home. So if there was one thing, if you could perform a miracle to change healthcare today that would fix something significant, what would be the first thing that you would do?
Mm. Okay, so in keeping with the principle that I ascribe to, which is that people in healthcare are actually the most important component.
Hmm.
If I could wave a magic wand, I would
Are you serious?
vastly increase the amount of investment that is made into workforce development and talent pipelines into the healthcare industry.
Hmm.
I think that we have a danger right now in focusing so much sometimes on the challenges within the industry and the difficulties that you can encounter within the industry that we run the risk of discouraging
Hmm.
young people in particular from being attracted to the industry and deciding to
Hmm.
work in
Hmm.
healthcare. And the truth of the matter is that, as I just mentioned, some of the days can be tough, but it truly is extremely rewarding work. It is work where you have no question about whether or not your life made a difference, had an impact, whether your effort has merit. It is morally a very high calling for someone to choose to dedicate their lives to this work. And so I wish that we would choose to invest more, fund more
Hmm.
scholarships, more training programs, open up more seats in medical schools and nursing
Hmm.
schools, and all of the affiliated disciplines to attract more talent to this area, which in turn is just going to end up making our communities healthier,
Hmm.
happier places. So if I could wave a magic wand, that's what I would.
Yeah. It sounds like even when you speak that you're speaking of hope. You're speaking of, you know what, hey, we have the potential and the ability to do this, to impact the younger generation, to say, hey, this is something that is so rewarding, right? And this is a great field to be in because you're not only affecting, your life, obviously, but people's lives. You're really making an impact on your community. Thank you so much for joining us for our very first Apex Health podcast. If today's conversation again changed your thinking out there and the universe, as Alex said earlier, or just gave you hope for, the future of healthcare, please subscribe, share this podcast with your friends or your family members or a colleague, and join us every 2 weeks as we continue these conversations with leaders who are shaping the future of medicine. Thank you. Thank you so much, Daffodil, for being with us today. Thank you so
My pleasure.
much.